The good news that I imagine the entire world is expecting is that tomorrow the Holy Father will be discharged. That means that he will return to Santa Marta. He is discharged from hospital. A brief summary, which is dutiful, as we were asked what has happened in this, 6 weeks? 6 weeks. So the Holy Father, at the time of his hospitalization here at the Foundation Policlinico Gemelli Hospital, had a respiratory crisis, which was acute and was due to polymicrobic virus, bacterius and fungus infection. These determined a bilateral pneumonia, which was serious and required drug treatment with combined drug therapy. During his hospitalization, his clinical conditions presented 2 very critical episodes, during which the Holy Father was in danger of losing his life. The drug treatment and the administration of high-flow oxygen, as well as mechanical ventilation, non-assisted mechanical ventilation, helped us to record a slow but progressive improvement, ensuring that the Holy Father were safe from the most critical episodes. He was never intubated. He was always vigilant and well-oriented and present in his mind. As I mentioned at the beginning, the Holy Father will be discharged tomorrow in stable clinical conditions, and they have been stable for the past 2 weeks now. Naturally, on the part of all the medical team following the Holy Father here at Gemelli Hospital, there is a prescription of continuing partial drug therapy, which he shall have to continue for quite a long time. These are oral administrations, and it's very important that he follow a period of convalescence and rest for at least 2 months. Thank you, Professor. Over to Professor Carboni. The Holy Father will return to Santa Marta. This is a protected discharge. It will require convalescence. We assessed with our colleagues who follow the Holy Father here at Gemelli, and we evaluated his needs. And as all patients who are 88 years of age and who have had pneumonia, we have decided we needed to assess what his needs might be, which is oxygen when needed, healthcare assistance that our own Directorate of Hygiene and Healthcare of Vatican City can offer to Santa Marta, and therefore we are ready to welcome him home. Thank you, Doctor. And perhaps we can answer questions from the journalist Ignazio Ingrao. Hello, Ignazio. Thank you, Professor Alfieri. Thank you, Dr. Carbone, for being here. I would like to ask, how will the life of the Pope be now he returns to Vatican City? What can he and can't he do? And will he have to go through rehabilitation in order to fully recover his speech? Mr. Carbone, the Holy Father is discharged for 2 months of convalescence. As all periods of convalescence, he will need to continue motor rehabilitation, which he has already begun, physiotherapy, breathing physiotherapy, which he has already begun. So he will continue to be looked after and to be cured. The Holy Father is obviously improving, and we hope that slowly but surely, he will be able to recover his normal activity. Professor Alfieri, during his hospitalization, the Holy Father has always continued to work, and he will continue to do so even when he returns to Santa Marta. The recommendation, clearly, as Dr. Carbone has explained to you, is that of taking an adequate time of rest and convalescence. And therefore, the answer is that immediately, no, he won't be able to go back to his work with groups of people whom he normally meets, or crucial meetings which he will be able to undertake once he finishes as convalescence, and of course once we register clinical improvements, which we expect. Look, I read the newspaper this morning, and when we have a bilateral pneumonia, the lungs are damaged. They have been damaged, as well as breathing muscles have been strained. One of the first things that happen is that our voice diminishes. It's though when you use your voice too much, when you shout too much, this happens. And for all patients, young and old, but especially older patients, time is required so that the voice will return to normal.